A doctor at Dartmouth-Hitchcock Medical Center is turning heads.
Thanks to his high-tech way of getting around, Kate Duffy has his story.
The Dartmouth-Hitchcock Medical Center has almost 1.5 million square feet of space. There are lots of ways people get around: wheelchairs, strollers, and their own 2 feet. But one doctor has a more innovative way to cruise the corridors. Dr. Michael Mayor has a Segway.
And it has made a tremendous difference.
The doctor's right leg was amputated after an illness when he was a teenager. He says the artificial limb he wore for 45 years was beginning to wear thin, and an injury forced his remaining knee to be replaced 2 years ago.
And then I began to develop sciatica, which was sort of 3 strikes, and either you're out or you figure out some other way to get from one place to another.
The other way, the Segway.
Well, the most immediate benefit was that my sciatica went away.
The high-tech scooter uses an electric motor and a gyroscope to keep its driver balanced.
All you need to do is step up on it, and the thing will actually do what you want it to do almost intuitively. You don't even have to hang on.
The Segway got a lot of buzz when it was unveiled 3 years ago. That it would revolutionize transportation like the car did to the horse and buggy. That hasn't happened yet, but Dr. Mayor says it has revolutionized his life.
I don't think there's any question that I've been able to do more and for longer than would have been the case without it.
And
how are you?
He's turning heads.
They all want one. I think almost universally there's a startled glance, a big smile, some sort of a salute, and then either, hey, that's cool, or I want one.
Dr. Mayor has a unique perspective on the Segway. He has an artificial limb, and he's also an orthopedic surgeon, treating patients who also struggle with mobility.
And it's a little bit of an ambivalent issue from my point of view, because in some respects, my job is to get them able to walk without depending on that. And my job also is to make sure that they develop a level of fitness which will carry them further than some machine would.
But for now, this machine is making his life easier. And he says this is just the beginning of the